Some lawmakers are calling to reinstate the federal assault weapons ban that expired in 2004. Others believe responsible adults should be allowed to have guns in school to protect students. Some lawmakers are also calling for a look at how mental health programs are funded. Michael Schoenhofer at the Mental Health and Recovery Services Board says in the past 3 to 4 years, the state has cut nearly $2 million out of the agency's budget.
There aren't miracle cures for every single thing that happens. If there are services available that we can access, then should anything arise, we know that we could get somebody to care as quickly as possible.
Connecticut law enforcement officials are not saying if the shooter had a mental illness. But Schoenhofer says cuts mean early intervention and prevention efforts are often neglected.
This highlights the fact that an untreated mental illness, you just don't know what kind of hell that individual was going through, and certainly created a terrible tragedy for that community and for our whole nation.
Schoenhofer adds that people with mental illness are more likely to become victims than perpetrators. And Sheriff Tricia says a third area needs to be examined: the increase of violence portrayed in the media.
I believe the television programs of how violent the programs are. 20 years ago, you didn't have as much violence as you have today.
The discussion on how to respond to the shooting will continue, but Democratic Senator Dianne Feinstein has already said she will introduce a bill in January to place a ban on assault weapons. In the studio, Tricia, your News Now.